Hi everyone, I'm Linda Esposito. I'm author of the book, The Be Clear Method to Living with Bronchiectasis. My book is available on Amazon. The Be Clear Method is a 7-step program to help you feel better and to manage bronchiectasis. It's important for you to know that you don't need to do all 7 steps right away. What I like to suggest is that people choose not what they think they should do, but perhaps what interests them most and start there. And then over time, you can add more steps. Big changes happen over time. So today we're going to talk about the third step of the Be Clear method, the one that begins with a letter C in the acronym, and it stands for clearance of airways, also known as Airway Clearance. I launched this YouTube channel last month with 3 videos on airway clearance because many people are uncertain how to do it. The other 3 videos are on nebulizing, OPEP devices, which are oscillating positive expiratory pressure devices, such as the Acapella and the Aerobika, and also one on cleaning and sterilization and descaling. I am pleased to consult with Monahan Medical, the makers of the Aerobika. Today's video is a lot of background information on the Aerobika as well as best practices. I did do another video, the one I mentioned on OPEP devices, and we went over some general information on the Aerobika, and I showed you how simple it is to use. So it's not going to get more difficult. If anything, I'm just going to give you a little bit more information. As we discussed, the Aerobika device is a handheld device and there is no medication that is administered when using it. What the person does is blow into the device to create back pressure in their lungs. It sort of splints open their lungs as if they were blowing up a balloon. Also, there's an oscillating or vibrating feature that helps to shear the mucus off of our airway walls and to help us with airway clearance. The device has a resistance gauge. I'm hoping you can see. It comes from the factory, actually, in a package like this, and it is preset. The gauge is right in the middle. It's preset at 3, but it ranges from 1 to 5, with 5 being the most resistance. The goal is to try to exhale into the device 3 or 4 times as long as you inhale, with about 3 sets of 10 or 12, or really whatever your medical team recommends. If this is difficult, you might want to adjust the resistance gauge down. Some people think that the higher the gauge, the better, but if you're unable to maintain a long exhalation, that might not be the case. Also, depending on your health and breathing, you might need to periodically make adjustments to the resistance. The Aerobika can be used in any position. This is one of my favorite things about it. And the mouthpiece can be rotated for comfort. Let me show you. So you can rotate the mouthpiece just like so. This means that you can hold it however is most comfortable for you, whether you're sitting up, whether you're lying down, and you can be in, as I said, any position. And it's especially helpful for people who don't have a lot of grip strength because they can hold it as if it were a sandwich with 2 hands. Once your treatment is completed, you can easily take the device apart to clean it. It comes apart into 4 pieces. You have the bottom housing. This is the cartridge that goes inside. And then there's the top piece, and there's the mouthpiece as well. And what's really good about this device is it only can go back together one way, so you can never make a mistake. But after you've finished it, as I discussed in a previous video on cleaning, sterilizing, and descaling, you do want to wash it at the end of the day. So all you do is take these pieces, take the device apart into pieces, and then put it in a little tub of soapy warm water. And I like to agitate the water because I think it helps to clean the device. So you let that sit for about 15 minutes. Recently, there was some very exciting research done by Dr. Joseph Falkenham from Virginia Tech. He found that very few bacteria stick to this particular plastic of the Aerobika and also the Airway Eclipse nebulizing cup. And this is good news for us who rely on this device. Some people have multiple devices, so they're not really concerned about cleaning daily. Perhaps they clean every so often. But for people who just have the one device, and sometimes perhaps they forget to clean it, or they're tired, or just life gets in the way, it's very good to know that very few bacteria are on the device. If for some reason, as I said, you miss the cleaning. However, with that said, daily cleaning and weekly sterilizing are what's recommended. So check the insert. It comes along with the device. Lots of good instructions here. And it will tell you the best practices for cleaning and sterilizing. So to use the Aerobika, we put the mouthpiece in our mouth and we take a deep breath for about 2 to 3 seconds. And then when possible, we hold our breath for the same amount, 2 or 3 seconds. And then the goal is to exhale longer, perhaps 3 or even 4 times as long as your inhalation. And you want to make sure when you're exhaling that you don't let your cheeks puff out. You want to keep them nice and firm and flat so that that breath will go deep into your lungs. The optimal treatment time is about 5 to 10 minutes with huff coughs intermittently after every 10 or 20 breaths, or really when you feel mucus coming up. That's when you can do a huff cough. And this therapy should be individualized for each person. And whenever possible, and I know it can be difficult, but whenever possible, you should try to meet with a respiratory therapist for guidance. I have found that sometimes when people can't get mucus up right away, they feel that they're doing something wrong, that perhaps they're using wrong technique or their huff cough isn't what it should be. And most of the time, I find this isn't the case. Mucus often wants to come up when it's ready to come up. And some of those, for some people who are very productive and able to produce a lot of mucus, it comes up pretty easily. But then there are other people like me that need to work at it. But when I say work at it, I mean in a gentle way. So when it comes to the huff cough, I hope to have several respiratory therapists on my YouTube channel to show us different techniques, because I have seen it shown in different ways. And again, not any one way is right or wrong, but it would really be what works best for you. But what you need to do is just create an O with your mouth, and then as if you were going to I've heard fog a mirror or blow on hot soup, whichever analogy works best for you. But what that does is it opens a flap on the top of your airways to allow the mucus to escape and to come into your oral cavity where you can spit it out. It's best to try not to use harsh coughs too often. I know sometimes we can't help ourselves because our body just is eliciting that sort of response. But what can happen with lots of harsh coughing is you can get additional inflammation in your airways, which sort of defeats what we're trying to accomplish. So you take a deep inhalation, and then when you're exhaling with a little bit of a oomph, a little bit of energy behind it. But you don't, with the huff cough, you do not want to strain or to blow too hard, as this can cause your airways to collapse. It's better to repeat the huff cough a couple or even several times But perhaps if you uh, want to, you could even try it in different positions. So this is referred to as postural drainage. And if you go online and just Google postural drainage, you'll see there are about 12 different positions. And sometimes a position might very well correspond to where your particular bronchiectasis or infection is. So, for example, if you know your bronchiectasis is in your middle right lobe, you might want to look on the postural drainage chart to see what position corresponds to that so that that lobe can be drained. Now, the thing with postural drainage is if you have issues with gastric reflux, whether you feel discomfort from reflux or not, because you can even have it when you're not feeling discomfort, you want to be very cautious with postural drainage. You certainly don't want to be doing any of this right after eating, for example. So you really need to speak to your respiratory therapist and get their guidance. But for me, for example, I'm completely honest and I tell people that there is really no way I could get any mucus up without using postural drainage. For 2 years, I used devices, I nebulized, and really nothing came out. I wasn't coughing or very little from using the devices, but at the same time, my CT scan indicated that stuff was in there, but it just wasn't, I wasn't able to get it out. And it was really through experimenting that I found that postural drainage made a difference for me. Luckily, I don't have any major issues with postural drainage, but with that said, I do take precautions. I elevate the head of my bed and I try not to eat a couple of hours before bedtime or even lying down in the afternoon to rest. So, but these are all tools for us, and the purpose of this video is really educational. These are things to discuss with either your doctor or perhaps, if you're fortunate enough, a respiratory therapist. I'm sure by now you're seeing that airway clearance can be somewhat of an art form. How we put all these tools together to help ourselves get rid of mucus is very much an individual thing. Um, Certainly, getting professional input from a respiratory therapist or your doctor is helpful, and also peer education as well, just hearing what other people are doing and what seems to work for them. So far, I have made, as I said, the video on nebulizing. We also had one on a breathing technique called autogenic drainage. Today, I'm talking about the importance of postural drainage for me. And in a couple of videos, we've talked about this wonderful little device, the Aerobika. And there's also the acapella, and some people enjoy or find that to be very effective as well. So, and then there's the huff cough. So let's not forget the huff cough, because the thing about a huff cough is, you could be feeling something coming up. Maybe you're a passenger in a car or what have you, and you just feel something coming up and you just need that little extra whatever to get it out. So that's what a huff cough is really good at. And as I said, hopefully we'll have some examples by professionals. But right now, I want to get back to the Aerobika. As I said, it has this manometer, which is a little bit of is a gauge. It's wonderful, and what's fabulous about it is it helps you know how hard to how much force to put behind your breath, because a real forceful breath can make your airways collapse, and that is not what we want to achieve. So I've demonstrated it before. I'm just going to demonstrate it again. Most importantly, you want to keep your cheeks flat, and you want to try to make your exhalation considerably longer than your inhalation. The insert says 3 to 4 times. I find that a little difficult. I'm more of a 3-time sort of person. That seems to be effective for me, but you got to play with it. So here we go. I'm just going to do a few breaths. I'm getting very dry. I'm going to do a few breaths and just show you what it looks like again. Sitting up straight, good posture. Okay. Inhaling. That's it. If you notice, there was a little bit of a breath hold after my inhalation. And again, if you're able to do that, fine. But even if you're not, the Aerobika will get the job done. So the manometer is a little bit difficult to find. I'm going to include a couple of medical supply places that carry it. And it's a few dollars more than a regular Aerobika. I shouldn't say a few, maybe it's like $20 more. But the good thing about it is that it does come off of the device, and you can put it on other Aerobikas if you have multiple devices. This little guy should not go in water or any steam bag or a baby bottle sterilizer. This stays out. You could just wipe it down a little bit with alcohol. And the arm, however, that the extension arm can be boiled or sterilized just as you would the rest of the device. Many bronchiectasis centers suggest that you attach your nebulizing cup to your Aerobika. This cuts down on airway clearance time. That's I would say one of the main reasons. And the less time it takes to do airway clearance, the more likely we are to do it, especially for those of us who perhaps have infections or a history of infections and do it twice a day. Also, I've heard from some top centers that the pulmonologists do believe that the saline gets deeper into your lungs by attaching them. Although the Monahan company really doesn't really say that. They just say that you lose very little by attaching them, which is always good to know. So I will do a video just on using these attached. But I think for today, we've reviewed enough. And just want you to know that just like with anything, it's like practice makes perfect. After, or I shouldn't say perfect, but it makes you feel more confident. And that's what we're looking for. So remember, do not change your current care without first speaking with your medical team. Please subscribe to my YouTube channel and like this video. Put your comments or questions in the comment box. I'm here to help. Are you interested in speaking with me? I offer 75-minute consultations, and the way they work is at first I'll send you a questionnaire and you'll fill it out. This is if you want to, you don't have to, but it's very helpful for me to get all that information up front and be able to review it before we speak. This way we can pretty much hit the ground running. And some of my clients also like to do follow-ups. So whether it's that every week, every month, whatever it is, it's up to them. I leave it to them to make that decision. But some people just do the one consultation and then they are on their way. So until next time, be well.